Hi, so my topic is on the Apgar score and it's really easy to understand. So it starts off as spelling out the words in the letters in Apgar. So it goes Apgar. So the A stands for appearance. So that's when the doctors are looking at the skin color of the baby to see if the baby is okay or if it's ready to go home with the parent. So therefore they look at whether it's pink, and you could see in the visual given right here as like if it's pink they would get 2 points. If the baby is has a pink body but the extremities are blue, so like the fingers and the toes are blue, that'd be 1 point. And then if they're blue and pale, that would be 0 points. So that's not very good to see in a newborn. The next would be P, which is the pulse. So they would take a stethoscope and check the beats per minute for the baby. So it's if it's over 100 beats per minute, that would be 2 points. So that's a regular for a baby. And then if it's below that, that would be 1 point. So it's like kind of irregular, but not as concerning as if it's absent. That's when it's extremely concerning and they need to check what's going on with the baby. And then at G, that would be the grimace. So that's reflexive irritability. So that's when the doctor does some type of pain stimulant to see. So they would probably add a little bit of pressure to like the pelvic area, or they would add pressure to the back, or pretty much little like presses to the baby's extremities or anything, just to see what kind of response that they would have to that stimulation. And if they respond promptly to that, that would be 2 points. And if they have a minimal response, meaning like they don't really cry or they don't really move or have any response to it, that means it's kind of concerning. So then we would go to A, which is the activity of the baby. So that's when the muscle tone is shown. So if they have muscle tone and they're very active, that would be 2 points. But if they're only flexing their arms and legs, that's a little bit more concerning. And it's not perfectly normal, but it's also not as bad as if it would be absent, which would be only 0 points. And then lastly, they look at the respiration of the baby. So they see if the baby is breathing correctly, and they check to see if they're breathing on pace. Like they need to see if the baby has a good pace of breathing. And if it's just like a vigorous cry, that means it's good. And that would be 2 points. And then if it's slow and irregular and doesn't really show up that much, it's the baby's still breathing, so they're not concerned, but it's irregular, so they need to make sure and monitor it. But if it's absent, that's when it gets 0 points due to it being it's an emergency and they need to check this. So that's what the Apgar score is. It's always done right after the baby is born so that the babies can be examined and seen if all of these right criterias are present after birth, and to see if the baby's able to go home or if it needs to be stayed at the hospital for a couple days just to be not monitored and checked, or if it needs to go into surgery or anything that they need to see if the baby's okay or not. And that's pretty much it. Bye.